everybody. This is Dr. Vittorio Puente, el amigo de la gente. Today I want to talk about, I want to answer a question of one of my viewers regarding medication anxiety and his son. Now, if I remember correctly, what he said was, "Dear wandering psychologist, I need some help with managing medications. My son, who has anxiety, often refuses to take his medications. What should I do?" He also writes, why is it that these medications take so long to work? Well, first, thank you for that question. It's a question that a lot of parents have. The first part of the question is, what should you do when your child does not want to take his medications? Well, there could be a lot of reasons why your child doesn't want to take medication. First, open a dialogue with your son and explore the reasons why he doesn't want to take it. One common reason is the side effects. The side effects of the first line medications for anxiety disorders is SSRI medications. And SSRI is an acronym, or short version for saying selective serotonin reuptake inhibitors. Now, SSRIs have positive effects on anxiety and depression. And one medication that is used with children, that is FDA approved with children, is fluoxetine or Prozac. And that is the first line of treatment for anxiety with children. The thing is, sometimes fluoxetine has some negative side effects, and the side effects, the more common ones, include stomach ache, headache, nausea, and some jitteriness that interferes with the child's ability to get a good night's sleep. And these kind of effects can negatively impact your child at school, and he doesn't want to feel like that probably, and he doesn't like struggling to go to sleep. Another common side effect is the experience of nightmares. And if your child is experiencing nightmares and doesn't want to talk about it, well, open that dialogue up with him. A second reason, and this reason has to do with the child's perceptions and appraisal of the meaning of the medication. The child might your child might think that taking a medication makes him crazy, and he is going to look bad with his friends if one of his friends finds out. Now, their dialogue is extremely important. Excuse the shaking, as the road's a little wobbly. It's extremely important to talk about then, because explaining to your child that taking the medication is going to improve, if it works, the quality of his life. That means he's not going to feel as jittery. He's not going to be feeling as afraid when he's in school, or when he's walking from school, or if he's around kids. Social anxiety, which middle schoolers often experience, so not often, but in terms of anxiety, they will have this really bad reaction being around people, and they start becoming withdrawn, isolated. And, well, explain to your child that that's what you want to try to correct and help him, and that nobody has to find out. This is medical information. If he doesn't tell anybody, you're not going to tell anybody either. That might be enough to calm him and his fears related to the medication. And when you're talking about, why do these medications take so long to work? Well, if it is the first line of medications to treat a broad spectrum of anxiety, then it's the SSRIs. Now, SSRIs are given a 2-week period to expect it to work. And the reason it takes so long is when the medication is administered, the molecule in the medication that's the active ingredient is supposed to bind with parts of your brain, the neurons, to allow more serotonin to build up in your brain. And serotonin has been associated with feelings of calmness, feelings of relaxation, that is an important counter to feelings of tension and nervousness that goes with anxiety. Also, if the medication does not work within 2 weeks when it's expected, you can always explore another line of treatment. I'd like to say now is with anxiety, if your child is diagnosed with anxiety, simply administering or prescribing medication is insufficient. Cognitive behavioral therapy, working with a skilled therapist who knows anxiety, who knows children, can be a great supplement and improve the outcome for your child to get rid of that anxiety. The quicker and earlier the intervention, the more likely you're going to have the positive outcomes you are looking for. So that's enough for today. I hope that I answered your question. And this is Dr. Vittorio Puente, the Wandering Psychologist. Until next time, be safe, everybody.